Hi everyone, my name is Steve Lawson.
My name is Anya Fofana.
Thank you very much for attending the SIGNA Masters scanning session for today, where we'll be highlighting the SIGNA Pioneer with the latest technology that we call SIGNAWorks Air IQ Edition. So just a little bit about this. So this particular system comes equipped with Air, which is a family of products that are really designed to be easier for the patients, improve some versatility with comfort. Also great with the technologists in regards to workflow and how these devices actually can improve their day. But then also some really great features to improve the overall image quality as well. So a little bit about the coils. So we have a variety of different coils in the portfolio, but specifically around the Air coils. We do have a 48-channel head coil that is available on the SIGNA Pioneer. We also have an anterior array that is an Air coil, which is really light coil, very flexible, very versatile coil. But then we also have smaller coils that are Air coils called the Multipurpose Coils. And they come in two different flavors of that, a 21-channel large coil and then also a 20-channel medium coil. Just to give you an idea about these coils, I'm going to switch over directly to my colleague, and she'll show you exactly what we're looking at with those.
So here you can see our large 30-element array coil. I want to show you the coverage because that is really unique. We have 65 centimeter with this coil. As you can see on my body type, I'm 5'10". It easily covers from the liver to the pelvis, just with one coil set up, the entire length. So that's really huge. You will see that in a few minutes when we scan our volunteer here live. And the other things I want to show you is really the versatility of that coil. So you can move it around. You can put it in the board any direction. You can set it like on the other side around. You can like grab it around joints, and really you have an option now for all these people coming into your facility which don't fit in a normal coil. These coils can be really like rotated and wrapped around, and you don't have to worry about coil overlap and coverage. With the new technology inside, there is no signal decoupling happening anymore, so that's really a nice coil which allows you to have a nice and easy workflow.
Great.
Thank you.
Well, thanks, Anya. With these coils, there are a lot of smaller elements inside of that larger array. So what we've done is we've developed an algorithm that runs on the system called Air Touch, and this is designed to improve productivity and workflow. In the past, there may have been long lists of flow configurations that were available on the system, but we've kind of simplified this a bit. So you simply just have two icons, and we'll make sure that we highlight that in the session. But two icons that you select, and then based off of the field of view and coverage that you're trying to achieve during your scan, the system can automatically turn off and on elements as it needs. So it really optimizes the productivity and SNR and coverage based on what you're trying to scan. So another thing that we have with workflow is AirX. So AirX is an automatic slice prescription algorithm that runs. And you can use this on the brain, but also in the knees. So it uses artificial intelligence and deep learning to automatically plot the slices, and it's a lot different than methods of the past, but it really helps you set up these exams. It's great for patients that come back for repeat studies, longitudinal assessments of disease, or just to be able to get more consistent, more reliable image quality. In regards to this particular release as well, SIGNAWorks Air IQ Edition is a lot of different features, and it's, you may have heard about Air Recon DL, which is a fantastic feature, but this is great for other applications that we have as well. So Air Recon, the core of Air Recon, not DL, but that allows you to scan and not be so concerned with out of field of view artifacts, so you can eliminate on your 3D volume slice wraps, or even, anatomy in small fields of view like cardiac imaging, where, you may see some tissue or anatomy coming into the small field of view, but it really can improve the quality there. I mentioned AirX, but we do have that expanded in this software release to the knee. And a new feature, which is really exciting, called Osteo, which is a method to image cortical bone. It uses a 0 TE acquisition to be able to do that. It's a really nice feature, and you can tell here by looking at the images, these MR images look nearly identical to CT or X-ray type images. Another thing that we'll highlight with body imaging specifically is Snapshot, single shot fast spin echo. These will allow you to do thinner slices and increase the number of slices without really impacting your overall scan time. We've applied, you can also use a Disco Star, Lava Star, which is a radial 3D filled acquisition to allow you to do free breathing body imaging. And then we've expanded Hypersense as well. So Hypersense across the 3D T1 weighted type scans, particularly for this session discussing body, Lava and Lava Flex, you'll see a dramatic improvement in the scan time. Outside of Lava Flex, you have the ability to use this on Bravo, MP Rage for brain imaging. And then we also have an enhancement to be able to see vessel wall. So this is called QT1 MSDE. And you can notice the background suppression is really great with the MSDE scans, allowing you to get better visualization of some of these smaller structures. But, new to this software, we've had AirRecon DL out for a little while, but AirRecon DL has now been expanded to the diffusion, which we'll highlight today in the scanning. But this is nice to be able to reduce the amount of signal averages that one might need at a higher B value, thereby reducing the scan time, so it can really give you a lot of productivity. But the image quality is dramatically improved across the board with diffusion weighted imaging. And one thing I wanted to show you today, we're here in our factory, we cannot give gadolinium, but I wanted to show you what some of these results look like in body imaging specifically. So this is an exam using Hypersense. So Hypersense to be able to reduce the overall scan time. Pre-contrast images, 15 seconds. The two-phase arterial images here, 7 seconds per 3D volume. So 2 of those acquired in a single breath hold. But you'll notice just really great results. And then also using Lava Star as well. As I mentioned, this is a free breathing acquisition. You simply do not have to place any type of navigator or have the patient hold the breath. But the results with these scans are turning out really nice. So I think without any further ado, maybe we jump right into the scan session, and then we show you guys what this system can do with the SIGNAWorks Air IQ edition. If you have any comments, please put them in the Teams chat, and we'll be sure to address those while we're scanning. All right, thank you.
Okay, everyone in? So please, your head over here, just on your back, and I'll put a nice pillow underneath your legs. Then go a little bit further up. So I will use the air coil, and we are starting to scan the pelvis, but then we are ending up scanning the liver as well. We don't have to attach any bellows, which is great. Can you get a little bit straight on the table? Awesome. So I just put the coil on top of the patient without using any additional bellows. And then, as you can see, the air coil is really light in weight, which is great. And then also it folds down like a blanket. So no need for me to use additional Velcro straps or attach the coil to the patient. I can just loosely put the blanket coil on the patient, and it will stay like that, which is great. Then he just gets the squeeze ball. I use the IntelliTouch feature for the landmarking. That means I can just do a one-click touch here and have the coil and the patient in the board. And then we are ready to scan. Everything possible?
Yes.
Awesome. So now we are here in front of the user interface. You see that I've typed in already the patient information, and then we can just go ahead and select the right protocol. We have highlighted the protocol for today, so we can just go ahead and start the exam button. So we run first the localizer in the pelvis. And then we start with the prostate protocol. So for the prostate, we are going to scan the T2 images with Ericon DL, with our deep learning. So maybe just to explain again once more what deep learning is. So there is a model-based who has been trained to understand which part of the K-space is really noise and which part of the K-space is signal. And what do we need in MR? The signal, not the noise. So the model has been trained to remove all the noise. So that really helps to make neither very fast image acquisition or high resolution image acquisition. And here in that example, we are going to show you that we can have really high resolution images. So we are going to scan a Pirates compatible protocol, so a T2 image, which is 3 millimeter slice thickness. And you can see here the in-plane resolution is 0.4 by 0.7, 3 millimeter in slice. And we are going to acquire the entire prostate in only 2 minutes and 38 seconds.
That's great. Yeah, usually these protocols can be long, even at 3T. Usually, 5 minutes or so if you scan at PIRADS compliant protocols. So.
And here you can see on the user interface how you would work with Recon DL. You see in the details page that we have a button which is called Recon DL Strength, set to high. That means that we are going to remove most of the noise out of the image. And that's all you have to do. Recon DL is built into the protocols, and then now we are running the scan.
So on the latest software that we have, SignaWorks Air IQ Edition, we have some new additions to Air Recon DL,
Yes,
which is really exciting. We've expanded it to allow for diffusion weighted imaging. So when you scan, once again, higher resolution or faster, diffusion can be a little bit long if you scan high resolution. So it's nice to be able to reduce the number of signal averages or the NECs at the p-values that you've selected.
yeah. So here we are using that new feature in our diffusion sequence for the prostate. So you can again see that it is embedded into the software, Recon DL strength set to high. So we can now finally use that also for our diffusion sequences.
Even when you do things like, synthetic imaging, sometimes the higher p-values can be a little bit noisy. Even though it's a calculated image, but this can dramatically improve the quality of your synthetic generated images or even the ADC maps that you would calculate to.
And then we just go ahead and plant some slices in the liver. So we will just rerun the localizer in the liver. So just place my slices further up. And then maybe we can talk a little bit more about AirTouch.
Sure.
So AirTouch is the feature we are using to recognize coils. And as you can see, the user interface here is
pretty new still. So we don't have to think about coils, coil modes anymore, and which one to select to give the best image quality. What we have is an air touch. That means the system does understand which coils are plugged in. In that case, we have the PA coil plugged in and the area A coil plugged in. And we always generate, before we run a localizer, a sensitivity map, so we know exactly where the coil is on the patient. And the sensitivity map is just a 2 seconds calibration scan. And in that time, we have every single element of the scanner turned on, and all the elements of the coil in the field of view do provide signal. So we know exactly where the coil is on the patient, and the scanner does the work for us, which is pretty awesome too.
Yeah. Yeah, before we had this list of coil configurations that the user could select or, deselect and selected one that they thought might be the correct one. So sometimes there was a little bit of guesswork in selecting those, but just simply turning the icon on, you know that the appropriate coil is going to be activated right exactly where you need it, covering through the slices, through the anatomy that you're scanning.
Okay, first images are already there. And here you can see 3 millimeter slice thickness, 0.4 by 0.7, in-plane resolution, scanned in 2 minutes and 39 seconds. Now we can have a look at the images without ARRI-CONDL.
Yeah, we still leave that as an option, right, to reconstruct the original images without ARRI-CONDL applied without any deep learning. So this is what the conventional reconstructed images look like on the right. And you can see how much noise we actually are able to remove from this. So giving you more signal, allowing you to get the resolution you want, the scan time you want.
So maybe one more time really to explain what ARRI-CONDL does. So ARRI-CONDL does the work in the K-space. So it's not a filter we are applying. So it's really, we just remove, this is the original scan, which is like 2 minutes and 39 seconds. And if we wouldn't have ARRI-CONDL, the images would tend to be a little bit noisy. Mm-hmm. So when you don't have ARRI-CONDL, in order to scan these high resolution scans, you would have to invest in scan time.
Yep.
So you would maybe do an average more, or you would like maybe, I don't know, like just increase the signal, read out more often to have all the signal you need. But with ARRI-CONDL, that's kind of like the first really exciting toy which we have, or tool in our hands, because we are able to scan these high resolution images and don't have a lot of scan time.
Well, unfortunately, I think sometimes the approach is to reduce the resolution, which is coming off of the PIRAD's recommendations for detection of lesions, and that resolution is quite important. 0.4 by 0.7 is the recommended resolution, but unfortunately, I think some people are actually reducing that resolution just to get a little bit more signal and to gain some time.
And gain some time is really the goal, right?
Yeah, yeah.
And on the other hand, so ARRI-CONDL in that case is just used to be high resolution. So maybe your goal is to just be always fast. Then that's also the perfect tool to work with ARRI-CONDL. So you can maybe just shorten down your scan times by always shorten down your averages, or maybe accelerate more. Usually you wouldn't do that because you would have noisy images, but with ARRI-CONDL, you can remove the noise, so you have the perfect tool in your hand to optimize your protocols.
Yes.
So the diffusion we are running is focus. Maybe some new words about focus. So we are using a technique where we reduce the phase field of view, and where we excite only in a certain phase field of view. So here in that example, we reduced it set to 50%. So we can be really having high resolution images again, and we don't have to worry about all the tissue on his right and left side, and that we excite and get signal there. We can really reduce that to that field of view. And then here we have set up the diffusion with B values 50 and 800. Mm-hmm. And we are not forced to scan these high B values, which are also recommended by the pirates. So here we are going to synthesize B values. Always when we have acquired 2 B values or more, we can synthesize as many B values as you want afterwards. And how to set that up? You type in the numbers here in the synthetic B value field, and then you can synthesize the B values you want afterwards.
Very easy to do.
Seconds, then we have the diffusion images ready, and then we just switch simply to the liver. So no need to do another landmark, no need to add bellows, even though we are going to do navigated sequences. The table is just moving, and we can just get the results and where the coil is positioned there. That's really convenient. Just think about your scenario. You have a patient with a prostate and you see there may be some metastasis in the liver. So there's no need to reposition the coil or like reassess the patient. You can just go up and scan.
Yeah. Yeah, the coil length is quite long. Even on taller adults, you can easily get, abdomen to pelvis. And a lot of cases too, what we're seeing is some chest, abdomen, pelvis. With one coil coverage, so.
Yeah, 65 centimeters is a lot. So this is done. So we are going to use our single shot sequences first to see how nicely we covered here the liver. And then I'm going to scroll through the images. Maybe I have to deselect it. Now it's gone. So here you see that the tracker placement was done, like again, automatically. So we don't have to think about where the diaphragm is moving. The scanner does that because the localizer has that post-processing task attached, which says auto tracker placement. And you see that it automatically got placed on the right part. And then we just go ahead and prescribe some slices here. And these ones are really high resolution, again, in thin slices, only 3 millimeters. Because also here we are going to use RE-CONDL.
So this is a new feature inside of SIGNAWorks Air IQ Edition. So the single shots are using something called Snapshot. So Snapshot can acquire multiple slices every respiration, where previous versions was acquiring only a single slice, we're able to get multiple. Now, depending on the patient's respiration, it can either acquire 2 slices or 3. If they're breathing slower, it can do a little bit more, right? So it'll probably do 3. But that's really nice because you've essentially doubled the amount of slices you can get in the same time. How we see a lot of customers using this is now that they can do this, they're scanning higher resolution and thinner slices. Now, normally that would be a problem with Signal, but since we got great tools like RE-CONDL, doing thin slices in the abdomen is really not a problem anymore. So this is a very helpful tool, we think. And you can do this, on, your coronals or axials, or even, with FATSAT on your single shots. It's really nice technique.
So then another new feature introduced into the latest software is LavaStar. So an entirely free breathing method to acquire images.
Yeah, so, usually a lot of people will do their lavas as a breath hold, but there is a need also to do delayed scanning after injection of gadolinium, where you're not really concerned so much about getting fast temporal resolution. You just want a really nice high resolution view of the liver. And that's where LavaStar will come in. You don't have to place navigators. You basically just set your volume up and scan. And because it's a radial fill, it's going to average out the motion that you would normally see by not using bellows or navigator. So this will give you a great T1 weighted acquisition.
For all the patients who cannot hold their breath, who cannot hear anything anymore, and who are really difficult usually to exam, right?
Yes.
Awesome. So let's go ahead and look first at the diffusion images we just did. So here are the diffusion sequences, also scanned with 3mm slice thicknesses, and then we go to the 800 p-value, so the slices should match now. You see the nice dark background because of Eric on DL. Again, and then maybe we just split one layout and we want to show you the synthesized p-value as well. This one is that, and you can see here the 1000 p-value coming up. And maybe we can even switch to 1500 because that is the one which is the interesting one. And you see that we still have enough signal.
Can you put the ADC map there as well?
Sure.
So we can look at that one?
You want to do it for us, or you want just overwrite that
Just
one?
replace the one in the middle, be fine.
Okay.
So the ADC maps are much improved as well.
With Eric on DL.
With Eric on DL, you can see a much better anatomical image even with the ADC maps. It's really great.
Okay, let's go back to that scan here. We just want to maybe finish up with a quick Mrcp. And also for the Mrcp, which we will do like in a radial readout, we want to use Eric on DL. Okay. Let's go ahead and do it maybe like this, right? We can use our lava star to maybe understand where his lever is. Maybe not that bad, right? Good, so here you can see we will do thick slices just in one breath hold. Maybe we do a little bit less than 6, maybe just 4. Okay, and then we will run that again with Eric on the L, selected here. Okay. And then just as an example, if you want to do a 3D volume, we are happy to do that. That is just here showing up. And here the 3D volume can be also combined with hypersense and hyperfocus if needed to keep the scan time short. So if you want to do a 3D volume, you also have a solution.
Yeah. So it's interesting, we've got hypersense available on, these Mrcp scans and other scans like Cube throughout the body, but we've also, on SignalWorks Air IQ Edition, we now have hypersense available on the lava scans too. So your regular routine breath holds like lava or disco, anything like that, you're able to turn on hypersense for those too.
And here are all the images in comparison again. So the original image without Eric on DL, and you can see all the noise in the background. And then on the right-hand side, the images with Eric on DL. And maybe just to point out, we've scanned that and acquired that with the 512 squared matrix.
Yeah, it's very nice. All right, great. So thank you everyone for your attention. We hope that you can join next month's live scanning session. Thank you very much.
Thanks and goodbye from Mrcp.